271-1035 WICY. It's your feel-good favorites from the 80s and more. 9:40 on a Wednesday. We're joined by those from Alice Hyde Medical Center. It's an update out of Alice Hyde inside the community. Dr. Lisa Mark with us. Lisa, how you been?
Excellent. How are you?
Doing very well. I feel good this week, refreshed. I watched a lot of football this past week, and my team wasn't able to make the Super Bowl, so now I got to sit and watch this Tom Brady guy do it all again. You watch football at all?
Not that much, when I can.
Yeah, well, hey, I know you're busy. I'm letting you know how I've been. You're busy with trying to deal with the vaccine rollout. What's the update on that initially?
All right, vaccine update. So how and when people in the community can get the vaccine is still obviously at the top of everyone's list of things to know. So let's start with an update on how people in the community can determine if they're eligible and set up an appointment to receive the vaccine once it's available.
I've heard so far in Franklin County that the vaccine rollout has gone very well.
It has. According to Franklin County Public Health, we're on par or actually ahead of other counties in the region when it comes to the percentage of people who've received the vaccine per capita. Mm-hmm. Unfortunately, that doesn't mean that everyone who wants a vaccine is able to get one right away, but it does mean that we're vaccinating people quickly and safely and using all of the vaccine doses that have become available to us.
Now, what about eligibility in getting a vaccine?
Yes, the best way to determine if you're eligible and schedule a vaccine appointment is to visit the New York State Department of Health website and use the online eligibility tool. That's at covid19vaccine.health.ny.gov. Mm-hmm. So covid19vaccine.health.ny.gov. And if you don't have access or you don't use the internet, there's a state vaccination hotline at 1-833-697-4829. So for everyone again, 1-833-697-4829. There are 2 state-run vaccination sites in our region. One is at SUNY Potsdam's Maxey's Hall, and the other one is at Plattsburgh International Airport.
Okay, so these sites are for administering vaccines by appointment only, right?
Correct. So don't show up if you don't have an appointment. You definitely won't receive a vaccine. You need to use the online tool or use the hotline.
Gotcha. For those who have been vaccinated or are about to be vaccinated, I'm sure there's some important information that you'll have for them to keep in mind. Now, people who've received the vaccine still need a mask and need to social distance even from each other, right, Lisa?
100% true. So this can seem counterintuitive, but for many weeks now, we've been hearing how the vaccines are the light at the end of the tunnel and the weapon that will win the war against COVID. Vaccines are, in fact, a critical step to slowing or stopping the spread of the virus, but it's not immediately going to return us to pre-pandemic life.
Right. And there's just... Go ahead.
Sorry. We need to reach herd immunity. So we need to vaccinate at least 70% of the population before we're going to see protective effects.
Right, because we're still seeing high levels of community spread, right?
We are. So we're seeing higher case numbers of COVID-19, both in the hospital and in the community than we did last year. And that means that in-person socializing continues to carry a level of risk, even if we're vaccinating the population. So based on how the vaccines work, it's likely that the risk will be lower for those who have received the vaccine, but it's not zero.
Yeah, protection isn't immediate or complete either.
Correct. One of the great things about both vaccines is they've been approved and they're effective. But just because you get a single shot doesn't mean you're protected. There's no vaccine that becomes effective the day you receive it. So it typically takes a week after the second dose for the Pfizer vaccine to reach 95% efficacy. And for those that get the Moderna vaccine, which is 94% effective, it takes 2 weeks after the second dose to get the full protection.
Transmission still a big unknown?
It is. This is one of the biggest and most important questions we still have to answer. Once you get vaccinated, can you still transmit the virus? It's possible that the answer to that question is yes, because what we do know is that nationwide, and according to the CDC, more than half of coronavirus cases are transmitted by people with no symptoms. Mm-hmm. So we need to collect more data. What we're trying to do is break the chain of transmission, and the best way to do that is to continue to mask and socially distance.
Makes a lot of sense. And you got to continue to calculate risk here, I think, as we end this conversation. That's very important.
It is very important. The message I want to leave everyone with is that we're making progress. We're still in the early stages of vaccine rollout. People are exhausted. I know they're fed up and they're upset in some cases that the process isn't moving more quickly. From a hospital perspective, we share that frustration. We want to vaccinate as many people as possible, quickly, safely, and efficiently, but we can only work with the supply of vaccine that's available.
Right. And
so please,
we're doing it the best as possible. And go ahead, please. What?
That's right. Please be patient, stay safe, and remember to do things that help keep your family and friends safe as well.
I think that's very important. Well, it's Dr. Lisa Mark with us. Thank you so much. I know I got talking over you because I'm just as into this as you are as far as getting the messages out to people and all that. So I'm glad you're with us. We really do appreciate it.
Thank you so much, John.
All right, it's 1027 1035 WICY. We are inside the community. We do this 9:40 Wednesdays with those from Alice Hyde.